Hi, I'm Dr. Sandy Culbertson. I'm a urogynecologist, which is a physician that treats women with urinary incontinence and pelvic organ prolapse. As far as my educational background, I went to medical school at the University of Virginia. I then came to Chicago for residency and did my residency and fellowship at the University of Chicago. I've been a full-time faculty member at the University of Chicago since 1996 and recently joined the staff at Silver Cross Hospital.
Dr. Culbertson, when should a woman come to see you? Are there any significant symptoms a woman has or anything that can signify that she needs to see a doctor?
So patients usually come to see me when there's symptoms of either urinary leakage or feeling that something is bulging from their vagina are so significant that it's starting to interfere with their quality of life. Other times patients aren't quite sure what is going on, particularly in the cases of prolapse, and they come to see us to verify what the condition is. Other times they'll come to see us if they're having recurrent urinary tract infections.
So what kind of urogynecologic conditions do you treat, or what does that even mean?
What a urogynecologist is a physician that's specifically trained in treating female disorders of the bladder and the lower urogenital tract. So that means the main things I treat are urinary incontinence, leakage of urine when a woman, uncontrollable leakage of urine. I also treat pelvic organ prolapse, which is conditions when the bladder drops, the uterus drops. It's kind of like having a hernia in the vagina. Other things that we treat are recurrent urinary tract infections and painful conditions of the bladder.
So is there a certain age that women are more prone to urinary incontinence or urinary issues?
So most of the women that we see have completed or have had children. Having a baby is one of the big triggers for the onset of urinary incontinence and prolapse issues. That doesn't mean that's the only thing that can trigger it. We'll also see women that have never had children. Women that do a lot of heavy lifting sometimes will develop these problems as well.
So it could be at any age, even if someone's 20 years old or 50 years old.
We see the full range of ages of patient, but most of our patients, I would say, are probably between their 30s and their 80s.
So how common is it to suffer from urinary incontinence?
So urinary incontinence is more common than you think. People tend not to talk about urinary incontinence. Some studies have shown that up to 20 to 30% of women will have incontinence at some point in their life. Again, people don't talk about it, so we don't even know how good that data is, but it's much more common than you realize.
So what different methods are used to treat urinary incontinence?
So we use a full range of methods. We have both non-surgical methods, including strengthening the pelvic floor muscles. We have medications for certain types of urinary incontinence. Sometimes simple things like behavioral therapies, limiting what you drink, can treat the urinary incontinence. We also do surgery for urinary incontinence. For certain types of urinary incontinence, this is extremely successful.
Dr. Culbertson, how many treatments does it take before you can get results, or what is your success rate?
Well, it depends on what type of treatment we're using. If it's medication therapy, that's an ongoing process where the patient's going to be on medication continuously. Things like pelvic floor strengthening or physical therapy will take a number of sessions with a physical therapist. For surgery, our surgeries today are more and more successful than they've ever been. So we usually tell patients it should be one surgery, one treatment for that.
So what does the process entail? They come in to see you, and then what's the next step?
Sure, they come in to see me. We figure out what type of urinary incontinence they have or if they have prolapse, and then we decide on a course of treatment. Some patients we can treat at the initial visit, depending on what we prescribe. Other patients will need to come in for some further testing and help us decide what type of treatment would be best for them.
So what treatments do you offer here at Silver Cross Center for Women's Health?
So the treatments we offer here, we offer treatment of prolapse, non-surgical treatment of prolapse with pessaries. We offer some minimally invasive treatments for urinary incontinence and medication therapy for urinary incontinence. Our surgical therapies for urinary incontinence are done over at the hospital.
At the University of Chicago Hospital?
And at Silver Cross.
Oh, at Silver Cross Hospital too. Perfect. I didn't know that. So how much will this cost? Is there insurance coverage?
Luckily, urinary incontinence and treatment of prolapse are all covered by insurance. They all realize that this has a significant impact on a woman's quality of life. So yes, this is all covered by your insurance.
What else should people know about their urinary incontinence or their own health?
Well, I think it's important for women to understand that early prevention can limit the risk of developing urinary incontinence, so pelvic floor strengthening early on is very important. Also simple things like watching how much caffeinated beverages, coffee, so forth that a person's drinking can also impact their urinary control. So a lot of things they can do on their own.
Very good. And last but not least, what do you think about the Center for Women's Health here at Silver Cross Hospital?
It is a beautiful center, first of all. We've been very happy and we like the idea of having a center just for women. It really goes very much to the theme of how we like to treat our patients.